everyone. I'm Linda Watson with HCA HealthONE Skyridge, and we are here tonight kicking off Dr. Jessica Ridgley's fantastic series that she'll be presenting us with great information on keeping ourselves healthy and hearty throughout our lifetime. You can look for us on Facebook on a number of different dates when just Dr. Ridgley will be doing her presentations. And I just wanted to thank Dr. Ridgley. She presented an outstanding workshop at our Women's Symposium on International Women's Day on Saturday. Lots and lots of great questions. And so we're excited to hear what she has to say tonight about stress and getting to the heart of the matter. So if you have any questions, folks, just feel free to put them into the chat box on our Facebook page, and we will take it away with Dr. Ridgley.
Hi, I'm Dr. Ridgley. I'm doing stress, the heart of the matter. I was supposed to be doing it in February, which was Heart Month. But it does affect a lot of things in stress, so I think we could have done it at any time of the year. I work at Skyridge Primary Care in Lone Tree. My information is here, and I also am board certified in internal medicine, osteopathic manipulation, and in integrative medicine. So most of my webinars are based out of my integrative medicine hat, and so if you have any questions about any of those, I do have them on YouTube, and I will share at the very end which ones I have for that. But tonight we're going to talk about stress. So stress, there's so many different life stressors, and we can't always wrap our head around all of them. And if we don't learn to manage it, it kind of takes control of our life, and we end up with many different issues such as depression and worsening stress and anger issues, irritability. But if we learn to manage the stress, we can actually have a significant advantage to how our life kind of plays out. So we're not going to change the stress, but we do want to try to find coping mechanisms that are healthy that can help us manage the stress. So there's a couple times of stress that are there. And so the plan tonight is we're going to talk about those types of stress. We're going to talk about the differences between acute stress and chronic stress. We're going to talk about some unhealthy coping mechanisms, foods that may hurt and the ones that can help. We're going to talk about exercise effect, the meditation effect. We're going to talk about some supplements, some botanicals, and then at the very end, I'm going to ask you to join me to work on some breathing techniques that may be very helpful for you moving forward. So I know many of us feel like this from time to time. The stress is coming at you like a huge wave, and you don't really know what to do or how to get away quick enough. So hopefully you're not feeling like that right now, but I hope you'll continue to join me throughout the rest of this presentation to see what we can do to help that. There's so many different types of stress. I've listed many of them here. I'm sure that whoever's listening has other ones that they could probably think I could add onto this list as well. There's everything from adverse childhood events, the ACE, that kind of perpetuate stress throughout the life, to deaths, family, kids. Work is a huge one I hear a lot. Injury that kind of puts an impairment on your lifestyle, divorce, career, college, putting your child through college, all of those create stress. And we have to find a way to help improve that. Let's talk about the difference between acute and chronic stress. So acute stress activates the sympathetic nervous system, which is that AKA fight or flight system. It is a direct path to the adrenals, and the adrenals put out different hormones like cortisol and different things that are similar to steroids, glucocorticoids, different things to kind of upregulate your system and get it ready to fight or flight. And so what it does is it addresses that first, and then it goes back to the brain and says, okay, just so you know this is going on, you might want to get engaged. And it increases the blood pressure, increases your heart rate, and gives increased oxygen to the system. It dilates all the vessels and all your airways for more blood flow and more oxygen. It starts to produce sugar in your system. Your liver starts to produce that sugar. You become mentally sharper so that you're aware of your surroundings and you're able to take care of getting away from that tiger if that's what you need to do. The problem is when it becomes a chronic stressor where it's not something that happens suddenly and then just goes away. When it becomes chronic, it actually goes to the brain first, and it'll go through this reptilian brain that we know that is that fight or flight system, but it's the amygdala and the hippocampus and the hypothalamus, all these different kind of internal systems that tells the body to do something. And so it doesn't go straight to the adrenals. Then it goes down to the adrenals and it continues to produce consistent cortisol and glucocorticoids that also increases the blood pressure, but it starts to increase it consistently and puts you at risk for heart attacks and strokes. It does not have a change to blood vessels or airways, so you don't have an increase in oxygen. And sometimes the vessels start to contract down, which is where you can start to get the brain fog and other things that happens with chronic stress. It can do a couple different things, and we'll talk about this on a different one, but it can either increase or decrease your appetite, both of which in chronically can become more of an issue. So what are some of these effects of stress that are concerning? Well, one of them is that it increases cellular aging, meaning that you will get old sooner. And most people I know don't wish that to happen. It actually does something to the DNA where it shortens something called the telomeres that increases aging very quickly. It also can lead to a decrease in brain mass, which causes a negative effect on learning, reduces your memory. It can weaken verbal memory as well. So some of that issues where people are saying, I have difficult time remembering names or remembering certain words that you should be able to remember. That is definitely an effect of chronic stress. It increases inflammation, so it causes a decrease in certain chemicals that help to decrease that inflammation. Some of those are in the brain, like BDNF, which I talk about in my cognitive decline video. And it talks about how it can increase your likelihood of depression and mood disorders. It also can decrease concentration and focus, which nobody really wants at any point in time. It causes persistent fatigue, and it can suppress the immune system. And that's actually a really important one. So by suppressing the immune system, it can cause an increase in inflammation. It can also cause an increase in illness and autoimmune issues. When the persistent increase in cortisol, I should say, can decrease certain types of immune cells, like your lymphocytes and your macrophages. And then it also decreases cytotoxic T cells and natural killer cells, which is very important when it comes to cancer. So if you have a suppression of the immune system, it can increase your cancer risk. It can lead to a decrease in appetite. And when people start to have this significant decrease in appetite, you have a decrease in your nutrition, you become malnourished, then you start to have a decreased absorption, and you start to have increased intestinal permeability, which is something that can happen in a lot of different things, but that's where you start to get that chronic stomach issues that can come with stress. And you can also have an increase in inflammation because of this and ulcers. The opposite is that you have increased appetite because of the cortisol kind of driving you mentally to want to and need more calories. And that can lead to weight gain, which also leads to overall inflammation. So neither one of these are good. It can increase the risk of clotting, especially if you have more of a genetic predisposition. Excuse me with that. It can increase heart disease, and it can also increase stroke. It decreases hormone production. So then it can also cause a reduced libido, decreased fertility. It can worsen menopause symptoms, and it can increase fatigue from that as well. So there's a lot of different things that stress can cause. So it's actually really important for us to find healthy mechanisms to decrease this. And sometimes that may mean some sort of change of lifestyle, that either small changes in lifestyle, but sometimes we need bigger changes in lifestyle too. So, and that just has to come as we figure things out. So some not so healthy coping mechanisms is things like, is alcohol. drugs, gambling, smoking, all of these are not good coping mechanisms. And if you do struggle with any of these issues because of stress, it's going to be very difficult for you to stop these because the stress is still there and we don't have good ways to cope with that. So please ask for help. This is the abuse and drug addiction hotline. The number is up at the top there. So if you do struggle with that, please do not hesitate to get help because sometimes we can't do these on our own. However, there are certain foods that can help improve stress and some that can actually worsen stress. So let's talk about the ones that can actually increase stress. I know everybody loves caffeine. I like the effects of caffeine too. Caffeine does have its positive and negatives, and some scientific studies have shown some of the positive effects. But it is important to understand that caffeine does activate the same place in your brain as when a predator is close to you. So it starts that fight or flight system almost immediately once the caffeine hits the system. And when that happens, it's only going to, it might help you have better concentration and focus, and it might help you feel like you're more awake and therefore you're coping with things better. But if you are significantly stressed and you're under chronic stress, caffeine is actually not your friend. Alcohol can cause disruptions of sleep, and it can also increase inflammation overall. The Surgeon General did put out information that alcohol does cause cancer. So it is now on the carcinogen list. And that is obviously, there's still some levels of moderation that is okay, but it does increase inflammation. And any kind of inflammation is going to perpetuate that stress. The one that I think is probably interesting to a lot of people is the artificial sweeteners. And the reason the artificial sweeteners can increase stress is because it actually changes the gut microbiome. And the gut microbiome is almost considered another organ system in and of itself that produces many hormones and helps the body produce hormones, produces chemicals that helps body processes. And it is very well linked to mood disorders and increasing anxiety. So if artificial sweeteners increase the bad gut bacteria, then it can actually increase anxiety and increase stress. They also have no nutritional value. The things that can improve your stress are things like fiber. Fiber decreases inflammation significantly and improves your gut microbiome and has been shown to decrease depression, anxiety, and stress. Omega-3s are huge. I think that that's a super important one. I kind of have that as one of my primary recommendations if you don't get enough omega-3s in your diet to take as a supplement. It decreases anxiety in almost all subjects that are tested and in scientific studies, and it helps mood. Fermented foods goes back to the gut microbiome. It helps to increase good gut bacteria, so it can actually really help with all of those mood disorders and stress. But the takeaway for this is that anything that decreases inflammation can actually help to improve your stress. So good nutrition and having a good diet and lifestyle is actually really important. So we talked about the sympathetic nervous system. Let's talk a little bit about the parasympathetic nervous system, and that is their counteracting partner to the sympathetic nervous system. They're both really important. One of the problems is that we seem to have a lifestyle that focuses more on sympathetic nervous system than parasympathetic. And parasympathetic needs to be in balance with the sympathetic. And what the parasympathetic nervous system does is it increases sleep hormones, it maintains focus, it helps to improve resting heart rate and blood pressure, it decreases your breathing rate if it's high, it helps to kind of provide a consistent muscle stimulation and helps with digestive enzymes. So it helps with a lot of different things that can be very helpful in kind of counterbalancing the stress side of it, which is the sympathetic nervous system. So they call this the rest and relax side, which I like to say that way because it's better than parasympathetic. But next thing we want to talk about is exercise. It is probably one of the most important things that you can do to help improve your stress overall. It helps to decrease cortisol. It helps heart rate variability. And I haven't talked much about heart rate variability, but Heart rate variability is the heart's ability to kind of vary its pace, which is found to, we first kind of figured this out with children who were in utero, and it's something that they watch as a vital sign when you're having delivery. Well, they found about 20 years ago that heart rate variability persists even after birth, and that if you have good heart rate variability, so it's actually increased, and they kind of use it as a number of 0 to 100. If you have good heart rate variability, that it actually decreases your all-cause mortality. And so I do think at some point this is going to be another vital sign, and it is a direct link to being able to evaluate your balance between the parasympathetic and the sympathetic nervous system. A good heart rate variability is anything usually around 55 to 75, and anything 50 or below is not so good. They have different things that can help to find out about your heart rate variability, and it'll even give you ideas on ways to improve it. Some of the things that I think of is the Aura Ring, which I've seen more and more people use, which is really helpful to kind of look at. And it uses heart rate variability as one of the main focuses of things that need to be changed. And then the Whoop also is a band that goes around your waist. No, not your waist, I'm sorry, around your wrist. And it can actually do the same thing. So the heart rate variability is really important. Exercise improves your heart rate variability. It helps to improve your balance between the sympathetic and the parasympathetic nervous system. It improves mood, it improves memory. It's protective to the neurologic system, so helps improve the fatigue and brain fog. And it enhances your immune system, and it helps your sleep. Let's talk about meditation. So we're not gonna do any meditation. We're gonna do some of the breathing at the end, but the meditation is super important and can be helpful. Exercise can be considered a type of meditation. Yoga is a moving meditation. Tai Chi is a moving meditation. The ones that they've actually tested when it came to stress is the MBSR, or mind body. Oh my gosh, I'm completely blanking on the name of that, but it is it was done by John Kabat-Zinn, and they have classes for MBSR that help to learn that and how to do it, and then continue with it. I think they're like 8-week sessions. Some of them can be done in like a week and do 8-day sessions. So, but they teach you how to do that. It helps to upregulate that rest and relax system. And what studies have shown is that you need about a minimum of 10 minutes a day consistently. And it's very important to understand that you can't like do it once and sit there and think, okay, it's going to be all better, because it just doesn't work like that. That balance between the fight and flight and the rest and relax is something that has to be developed over time. And this is a way to strengthen that balance. And it is something that has to be done consistently. There are also therapy type of sessions that can help with this. It's called MBCT, which is cognitive training, and that is done with a therapist. And you can also use apps to help with meditation. Some of the apps that are probably the most common ones are like Calm app, the Headspace, Insight Timer. These are all ones that can be used to help with that. So if you have any questions about meditation, please let me know at the end, but it is something that can definitely be used to help with stress, and it's only 10 minutes a day has been found to be useful. So sometimes I absolutely feel like this, like I need to go out, get a bunch of lavender and lay it all over my body. I actually wish I liked the smell more. All right, supplements for stress. There's a lot of different supplements that can be used for stress. I chose these because I think that they can be very, very helpful. All three of them are ones that have multiple uses, and they are also things that are kind of on the top of my list for multiple things. So let's start with magnesium. Magnesium is the relaxant to the body. It can be super helpful in multiple different situations. It helps relax muscles, it decreases blood pressure, and it can up to about 10 points. So if you're just over that line and you want to help with that blood pressure, it can help to decrease it. It improves sleep. significantly. It helps to improve constipation if you have issues with that. It helps with DNA synthesis. So when we were talking earlier about how stress can cause increased cellular aging, this actually decreases cellular aging. It decreases anxiety. It helps bone health. It improves exercise recovery, cognitive function, and it helps with insulin metabolism, which is one that I use it a lot for in my practice. And the amount that I recommend is around 200 to 400 milligrams daily. If you want something that's going to be a little bit more helpful with sleep, either magnesium citrate or glycinate can both be used. If you want something that's going to have a little bit more of an effect on the anxiety, magnesium threonate is probably your best bet, as that is the only form of magnesium that can cross the blood-brain barrier. That's actually a little bit lower dose than the citrate or the magnesium glycinate. The magnesium threonate is around 125 milligrams. So the omega-3s, I talked about this in one of my very first lectures about nutrition and how incredibly important they were, and the fact that in our current standard American diet, we get about 1 omega-3 to about 20 omega-6s, and that should be a 1-to-1 ratio. And that imbalance of those omegas actually is what increases the inflammation significantly. You need around 1,200 milligrams daily of the EPA and DHA, which are from mostly fish or animal products, and then 600 milligrams of the alpha-linoleic acid, which is ALA, and that is from plants and seeds and vegetables and things like that. It has a significant effect on mood disorders, especially depression and anxiety. It helps to improve brain health. It decreases the risk of heart disease. It helps to improve symptoms of ADHD, and it helps to prevent dementia. So omega-3s are super important. It's one of my main supplements that I recommend. And if you don't feel like you get enough, I would either recommend getting around 4 ounces of fatty fish, like salmon, halibut, and that kind of thing, at least twice a week, or you can supplement it. My last one is L-theanine. This actually comes from green tea and is very interesting. The recommended amount for an adult is between 200 to 400 milligrams daily. It is something that helps to shift the brain waves to more of the focused brain waves in the frontal lobe. And this has actually been found in functional EEG. And because it can help to improve that, it's very helpful with ADHD type of symptoms, which honestly, I think a lot of the newer ADHD diagnoses are actually chronic stress as well. So this can be significantly helpful to help improve that focus and concentration. It helps to reduce stress and anxiety. It improves immune function, and it does support restful sleep. All right, let's talk about some botanicals for stress. I picked these 3 because I also find them to be very interesting and very helpful, and these are some of the ones that I use quite a bit. Well, the first 2 are ones that I use quite a bit in my practice. The first one is valerian root, and the interesting thing about valerian root is that is what Valium came from and what started the pharmaceuticals with the benzodiazepines. The thing is that the herb itself has a few counterbalancing mechanisms that the medicines do not have. And valerian root can be found in capsules and tinctures. I actually really like it in the tincture because I think it helps hit a little bit faster, especially if you're having acute stress. And the dose is between 300 to 600 milligrams. It decreases signs of anxiety and functional EEG. It improves sleep, and it does not suppress the heart rate, the blood pressure, and the breathing that you would find in some of the benzodiazepines. They did a study that compared valerian root to midazolam, which is the benzodiazepine that they use to initiate anesthesia before surgery. And they looked to see if they use either one, if there's a difference. And there was actually no significant difference in the amount of decreased anxiety and stress reduction that happened with either valerian root or midazolam. but there is less of the issue with the heart rate, blood pressure, and breathing suppression, where valerian root didn't seem to do that and the midazolam did. My second one is rhodiola. Rhodiola, the dose is between 100 to 600 milligrams. And I don't typically give out recommendations for brands here. I am going to today just because I do think it is important to find a good one. And I will say that I think Gaia Herbs is actually one of the best botanical companies out there. They are very accurate in how they measure and making sure that their formulations give you the actual dosage that you need. So like the valerian root, they do have a tincture for that. And the rhodiola, they do have that. It usually comes in about 500 milligrams. And that's even safe for children that are like kind of about 8 years old or over. And rhodiola is an adaptogen. And what adaptogens do is they actually interact with your adrenal function. And in the case of rhodiola, it actually helps to decrease cortisol, but it also improves fatigue. And it's interesting because they don't really know how it does, how it reduces the cortisol, but then increases the fatigue or improves the fatigue, sorry. And it improves your focus and attention and concentration. When they did studies on quality of life, they found that individuals who are actually given the rhodiola versus the ones who weren't had an improvement in their quality of life scores for stress and fatigue. It also improves muscle fatigue in athletes. It improves sleep, memory, and alertness. So I do recommend taking it in the morning and not at night because it can cause you to have a similar effect to caffeine without having the same predatorial effect that caffeine can have. The last one is the lemon balm, which is from the mint family. It is actually safe in a very high dose, anything from 600 to 1600 milligrams of extract, which is a specific type of formulation, has been found to be safe. It can decrease anxiety, help insomnia, reduce muscle tension. It can help GI symptoms. So if you are having symptoms that are GI related, in regards to your stress, this might be a really good one. And it is very antioxidant and antiviral, so maybe a good time during the winter time. So those were the three supplements that I absolutely recommend: the valerian root, the rhodiola, and the lemon balm. So next, we're going to talk about breathing. And I'm going to lead you through some breathing exercises. I will not be able to participate in them with you, but I'm hoping that the things that I put up will help you kind of understand what those breathings are. So the first one I want to talk about, first I have a quote. Our breathing is a fragile vessel that carries us from birth to death. It absolutely is. And if we do not learn to breathe when we are younger, it will affect our health later on in life. Talking about diaphragmatic breathing. And this is when you actually consciously focus on your diaphragm to help it expand and to contract. And when it comes to breathing techniques, I'm going to kind of use this for all of them. You want to use about 5 minutes for a therapeutic effect. So what I tell people who have significant anxiety issues regarding and having underlying stress, I recommend doing this for 5 minutes every day to basically train yourself to use this when the stress becomes so much that you are overwhelmed, and it helps you to remember to do it at that time. So remember that 5 minutes is important. We're not going to do 5 minutes for each of these breathing techniques. We're going to do about 1 minute each. And when we're doing these breathing techniques, you need to avoid standing because you want your body in a relaxed position, but you want to make sure that you're sitting up straight. You want to try to avoid kind of any interruptions because that kind of interrupt the effect and you may have to kind of start over. You do not want to hold your core tight. You will use the core to some degree, especially with diaphragmatic breathing, but you want to allow it to expand and contract. And you want to not get a type of technique that is so technical that it's really difficult to do it. You want something to be relatively easy so you can practice it, and when push comes to shove and you need it, you can use it. So in diaphragmatic breathing, well, in any breathing, really, the inhalation is active and the exhalation is passive. But in diaphragmatic breathing, the very end of the exhalation is going to be more active to kind of push it out. So make sure you're seated comfortably and join me with this diaphragmatic breathing. You're going to breathe in slowly, consistently. You want to feel your belly move outwards and almost as if that breath goes all the way down into the pelvis. And then you exhale. You want to let it all the way out slowly, consistently. Make sure that once you feel you don't have any more air to let out, try to let out just a little bit more. Let's go ahead and inhale. Let your belly relax, your lungs completely fill up. Allow the breath to go all the way down to the pelvis. And then breathe out, allowing yourself to allow your belly to just relax initially, your air to come out of the lungs. And then towards the end, go ahead and breathe out even more. Go ahead and breathe in. Allow your lungs to fill, your belly to relax, your pelvis to fill with air as well, everything to expand, and then start to let the air come out naturally and allow your belly to come in and then contract at that last moment. Let's do one more. Breathe in, let your lungs fill up, let your belly relax, let your pelvis fill. I've reached that last little bit of sip of air, and then start to relax and let it slowly, consistently come out, allowing your belly to relax, your lungs to come back together, your chest wall to come back together, and kind of push out that last bit of air. So this is diaphragmatic breathing. It helps to slow the breathing and to allow you to consciously feel it come in and out and actually notice how it makes you feel. So that is one form of breathing, which is called the diaphragmatic breathing. When it does come to anxiety, the next breathing technique is probably the most commonly recommended. It is also the one that has been well studied. It has been found to lower blood pressure, to decrease pain, reduce that feeling of being overwhelmed. It helps with COPD management. So it is very helpful. And sometimes, and you have to choose a reasonable amount of time for this one because you are holding after your inhale and after your exhale. And so I want you, while we're doing this one, to actually focus in on that diaphragmatic breath, that when you actually inhale for these 4 seconds, that you fill it up completely, you hold it, and then you will exhale completely and then hold it. So I will count for you, and we'll do about 4 breaths for this as well. So make sure you're seated comfortably, upright. Go ahead and start an inhale for 1, 2, 3, 4. Pause 1, 2, 3, 4. Exhale 2, 3, 4. Hold 2, 3, 4. Inhale 2, 3, 4. Hold 2, 3, 4. Exhale 2, 3, 4. Hold 2, 3, 4. Inhale 2, 3, 4. Hold 2, 3, 4. Exhale 2, 3, 4. Hold 2, 3, 4. Inhale 2, 3, 4. Hold 2, 3, 4. Exhale 2, 3, 4. Hold 2, 3, 4. Now you can just breathe naturally. This one is very good for panic attacks, for moments when you feel extremely overwhelmed. And it does have to be practiced because if you don't, you will not be able to really slow down your breathing. But you can also look at it as a goal in those moments. Maybe you can't hold it for 4 seconds. Maybe you can hold it for 2 seconds. And that's okay. You work until you actually get to that full 4 seconds. And in practice, I actually recommend to increase the seconds and see if you can kind of expand your inhale and exhale and your holds. So that can help you in those moments with significant anxiety and being overwhelmed. My last one is something that is taught more in like yogic breathing and that kind of thing. And it's called alternate nostril breathing. And it enhances autonomic control. So when you're talking about balancing that sympathetic and parasympathetic, that fight or flight or that rest and relax, this one will specifically do this. It does increase your heart rate variability. It decreases stress and anxiety, and it improves clarity of thought. It also can be very helpful to use it for sinus issues. And the way that you do it is you hold one nostril and you breathe in as completely as you can. And then you switch nostrils and you breathe out completely through the other nostril. Then you breathe in through that nostril, switch again, and breathe out through the other nostril. The recommendation is to either use fingers like this, sorry, that does not look right. Fingers like this, either way, fingers like this, either way, it doesn't matter, but it's hold and switch. So that's how you do it. Any of those hand combinations can work. Whatever is most comfortable for you is what you want to use. So let's go ahead and try this. We're going to do about 4 breaths. So go ahead and hold one nostril closed and breathe in through the other nostril, allowing your lungs to completely fill up, your diaphragm to relax, and your belly to open up. Then switch your fingers and hold the other nostril closed and breathe out. Relax the belly. Let your air come out naturally. When you are finished with that breath, then you switch it, you hold that one, sorry, you stay with that nostril, and you breathe in through that nostril, filling up your lungs, filling up your belly, bringing it all the way down into the hips. And then you switch and you breathe out, allowing everything to slowly come out that one nostril, relaxing. Once you're completely finished with that exhale, you breathe again through that nostril. Breathe in, filling the lungs, relaxing the diaphragm, opening the belly, opening and filling up the hips. And then you switch nostrils and you breathe out through that nostril, letting everything naturally just come out. Once you reach the end of that breath, you breathe again in through that nostril, filling up the lungs, relaxing the diaphragm, opening the belly and filling up the hips. And then you switch nostrils and you breathe out through that nostril until you fully complete the exhalation, naturally relaxed without any force. So that is alternate nostril breathing. It can be very helpful to calm the mind and to improve your heart rate variability. I hope that these 3 different breathing techniques are something that might be something interesting to you, and you could choose one to practice on a daily basis to help you if you have these issues with anxiety or being overwhelmed from stress. These are my other webinars. I did one a while back on nutrition, the basic truths and dispelling myths. I talked about gut health and inflammation, diabetes and lifestyle, natural ways to improve heart health, cancer prevention, sleep, environmental toxins. I'm going to put a little bit of a plug for the environmental toxins. I do believe it's a very heavy subject, and it can be overwhelming to listen to. So maybe not right after you're feeling stressed, but It is a really good one that I think people need to understand how it does affect your health. So I really think that that's an important one from a knowledge perspective. I also did one on cognitive decline and dementia. And my most recent one was to help chronic pain and different things that can help chronic pain. If you go to YouTube and search my name, it should come up. If you have difficulty finding it, add one of the things like heart, diabetes, gut health, anything like that, and it will come up. It just kind of depends on how often it's been watched, but they should all come up. And I did check that recently. My boss told me to dress for the job I wanted, not the job I have. So now I'm sitting here in a disciplinary meeting dressed as Wonder Woman. Wouldn't that be fun? Be able to dress up like Wonder Woman every day. Not really. But anyway, I thought that was funny and I hope you got a laugh out of it. Thank you so much for joining me today. And if there are any questions, I'm ready for it.
Thank you, Dr. Ridgley. That was wonderful. And you are Wonder Woman. So we appreciate that. But we do have two questions. One of the questions was, where do you get the aura ring?
So the Aura Ring is OURA, and you can just go to aura.com and they have this program where you just request a fitting set and you'll get it within like a week, less than a week, and you figure out what finger you want to put on it, put the ring on, and what size you want, and then you ask them or you send a message back to them about what size, and they send it to you.
Okay, great. And
Mhm.
then there was another question about, um, you talked about teaching children to breathe appropriately because you want them to get into good habits. Um, do you have any suggestions on how to actually do that?
It does help if they're a little bit older. Um, but honestly, like spending some relaxing time with them and being like, let's take a deep breath can be very helpful. With kids that are about 5, 6, 7 years old, you can start to teach them and you can even have them join in with you with doing your own breathing practice. And I would start out with a diaphragmatic breathing and talking to them those cues, those word cues that describe how it feels in the body is super helpful for children. So that is very important to make sure that you kind of cue them and you kind of help them know the amount of time to breathe. But actually getting them involved with a breathing exercise that you do for 5 minutes a day can really help them deal with their own stress, especially as they get older and into like fifth and sixth grade, which is where my kids are right now, and it is kind of stressful. Um, so teaching them how to do that can be really helpful to just do it with them or have them do it with you.
That's great. And and there's one final one. You touched a lot upon the, physical um, reaction to stress. Um, but is chronic stress, is that going to be very detrimental to one's health? Because I don't think people put enough, according to our um, person who wrote in, enough emphasis on stress and how much it does to the body.
So stress affects every single chronic medical disease. It worsens it and not not improving that. I mean, you can actually help stress work for you if you know how to manage the stress. But if you do not know how to manage the stress and you're in chronic stress constantly, it worsens every single aspect and it can cause medical issues that you may not have otherwise had. For example, with the effect of the immune system, it can cause you to get more illnesses that you might not have gotten had you not um, had the stress kind of ruling your life. And so it is, I agree with the person who wrote in, it is this word that we use that's just kind of like, honestly, like flu. I'm going to use flu as an example. I'm going to use an analogy here. So when COVID hit, everybody's like, oh my gosh, COVID is horrible. It's the worst thing ever. And it was horrible. It really was horrible. But we had forgotten that flu can be just as horrible as that. And like flu this year, we had an epidemic which sent people young and old to the hospital because we hadn't forgotten that flu can be that powerful. And so stress is the same thing. If we do not get control of it and learn to manage stress for ourselves, it can not only ruin our health, it can ruin our relationships, it can alienate us, it can cause severe depression. And all of these are not light things that happen to us. They are things that can completely affect our quality of life. And it's one of the reasons I wanted to talk about it because I think that we do need an emphasis on stress and managing stress because it can actually really ensure that we have more control over many things in our life.
Thank you. Thank you, Dr. Ridgley, for another incredibly wonderful presentation. We look forward to your upcoming ones, and the three that are going to be quarterly throughout the rest of the year. And of course, everyone come to the HCA Health One Skyridge Facebook page and you'll see those dates. But thank you, as always, for providing us with great information to stay healthy. Thank you.
Thank you. Have a good night.